Department of Health is giving a provincial update this morning. Abongile Jantjies has more on this. A very good morning to you, Abongile. What can you tell us about the Eastern Cape this week?
Good morning to you too, Desiree. Well, the briefing is about to start shortly at 10 o'clock to be precise. Well, I've managed to grab the attention of the spokesperson of the department before we get into the briefing. So kindly tell us, what's the purpose of this briefing today in terms of the coronavirus pandemic?
Well, it's part of our program to brief members of the public about the work that we are doing, the important work and interventions that we are doing to ensure that we save lives as we continue to battle against the pandemic, the interventions that we are putting in place, the number of admissions in our hospitals, the number of those that are in a critical condition, and also those that have received the life-saving jab, and also to urge people to continue playing their part in ensuring that we are safe from the pandemic. So we want to update the people of the Eastern Cape about the work that has been done so far. Where are we? What are the new challenges? What are the new milestones that have been achieved? And how the people can meet us halfway to deal with the situation.
Talking about the life-saving jab, last week you announced that you've surpassed the 1 million mark. How far are you in terms of reaching your set goals and targets?
Well, the MEC will deal with that, but you will recall that we have announced that we want to vaccinate as many as 4.5 million people in the province. We started with health workers. We moved to 60 and above, and we went down to 50 and above. We are currently looking at 35 to 49. That would ensue from the 1st of August going forward. So we continue to ensure that there's vaccine availability. We continue to create and establish more sites across the province. We are not working alone. We've got NGOs that are on board. We are now talking to medical aid companies and other private companies, because we have to deal with this with all that are concerned, so that at the end of the day we reach our goals. At the end of the day we save the lives of our people.
Tell us about what's the general, what can you say about the willingness of the people of the Eastern Cape in terms of those who are eligible to receive the vaccine? What is the willingness or is the reluctance? How are you overcoming those issues like that?
We only experienced reluctance when we started with the first phase, which involved our health workers. At the time, there were a lot of myths around the vaccine. However, that is beginning to be the thing of the past. People have seen that those who have taken the jab have survived, and they are coming forward in numbers, particularly the old age group. They came in numbers, and also the economically active group, that is 35 and above, they came in numbers. And even though we said we are ready to inoculate them from the 1st of August, but they registered as soon as we opened the portal on the 15th of this month, and the following day they were flooding our vaccination sites looking for the life-saving jab. Some started, but we had to say from yesterday, hey, hold on, wait until the date, because now we are likely to run out of vaccines, because we had not yet received vaccines for that economically active group.
The issue of filling critical vacancies, I understand that you've also renewed contracts of a number of healthcare workers, and you've also introduced to the public a new HOD. But why do these processes of government take so long to, especially a critical position like an HOD of a department, even though there was someone who was acting in that position, but it's been months and we're under the effects of COVID-19. Why do the processes of government take so long, particularly in your department?
Well, not only in the Department of Health, across the public sector, there are policies. There's a recruitment policy that has to be followed. And we are happy that the Premier has announced the new permanent accounting officer, Dr. Rolin Wagner, who is going to assume duties on the 1st of August. We have also embarked on a recruitment drive focusing on clinicians. I'm also happy that we were also able to extend contracts for those nurses who are contracted for COVID-19. You will recall that the contract was supposed to have ended on the 30th of June, but that has since been extended, allowing us to be in a better position to deal decisively with COVID-19.
The public protector made and it gave the department a number of reports that this should be implemented. In terms of saving time, we won't dwell into them much, but how far are you in implementing the recommendations of the public protector?
The Deputy Public Protector came to the province late last year. So at the time they made their findings public, the department had already started addressing some of the issues that were contained in the report. Recruitments, we've recruited over 80 personnel in the Torangidza Hospital, and a number of issues that were contained in the report have already received attention. Of course, we are fixing a moving path, so we continue to look at what needs to be done as we move forward.
I thank you so much for your time, sir. Well, Desiree, that was the spokesperson of the Eastern Cape Health Department, Sizwe Kupelo, giving us a preview of what the MEC Nomakosazana Meth is set to touch on. Well, as we speak today, to date, at least